and welcome to my oral presentation on the plague. My name is Lindsay Potts. Let's learn a little bit about the plague, also known as the Black Death. What is it? Where did it come from? How did they treat it? As well as the historical impact it had on the country. Yersinia pestis is a gram-negative, non-motile bacterium discovered in 1894 by Alexander Yersin. The bacteria, named after Alexander Yersin, called Yersinia pestis, is considered a zootonic bacterium that mostly live in and on small mammals and their fleas. The most common way for humans to get the plague is by the flea bite. Although the plague is a rare disease, the plague can manifest into 3 different forms: the bubonic, septicemic, and the pneumonic plague, each having their own very distinct symptoms and severities, ranging from a fever to lung and bloodstream infections. You may be wondering how this very fatal disease is passed along. Fleas pick up the bacterium and transmit it to humans. The pneumonic plague can spread via cough droplets from person to person, sneezing, and close contact. The bubonic and septicemic plague are not contagious, but the pneumonic is. The most common sign of the bubonic plague is swollen, painful lymph glands. This is commonly known as a bubo. Your healthcare provider may suspect the plague if you have a flea bite or a bubo. If left untreated, the bubonic plague mortality is 30 to 90%, and the pneumonic plague is nearly 100% fatal. That is why early treatment is critical. Symptoms might include high fever, chills, headache, chest pain, rapid breathing, severe shortness of breath, and a cough that might even bring up some blood, as well as nausea, vomiting, diarrhea, and abdominal pain may also be some symptoms. In order to diagnose your symptoms, the healthcare provider will take a sample of your blood, your sputum, or fluid from your lymph nodes. They will then send the sample to the lab to look for signs of Yersinia pestis bacterium. Unfortunately, they no longer make a plague vaccine available in the United States. Historically, treatment and prevention at the time did not help. Sometimes patients were bled with leeches. Doctors thought that the leeches would draw out the bad blood that caused the disease and leave the good blood in the body. People thought that impure air caused disease and could be cleansed by smoke and heat. Children were encouraged to smoke to ward off bad air. Could you imagine us encouraging our children to smoke these days and the repercussions we would get from that? Early antibiotic treatment, especially immunoglycosides, drastically improve outcomes. Public health includes vector control, such as getting rid of the rodents and using pest control spray to kill the fleas, and by partaking in quarantine measures. The plague reshaped society, labor markets, sanitation, and public health norms. It still remains an endemic in some regions. There were 3 infamous plague pandemics in history. Number 1, the plague of Justinson. Number 2, Black Death, causing 25 million deaths in Europe alone. And third, the plague pandemic that spread to every continent except Antarctica. It killed around 12 million people in India and China alone. Although rare, the plague still occurs today. On average, there are around 7 human plague cases reported each year in the United States. The plague often occurs between western U.S., with most cases in northern New Mexico and Arizona. More recent plague epidemics have occurred in Africa, Asia, and South America, but most human cases since the 1990s have occurred in Africa. It reminds us of ongoing vigilance and public health resilience. And I just want to point out that this mask is a sample of what they used, what the plague doctors used, to what they thought would preserve them from contracting the disease. In summary, the plague remains a testament to the power of antibiotics and public health measures. Despite advances in treatment, Yersinia pestis remains a significant public health threat, requiring continued surveillance, especially in the endemic areas. I also want to point out that they had a plague proclamation for the plague, and persons neglecting to comply with this could be persecuted for a common law misdemeanor. I want to thank you for joining me on my presentation, and I hope you learned some informative information on the plague and the blackness it caused on the country. Please stay tuned for my works cited page.
Six minutes and like 10 seconds.